So Laura, you're here today after you haven't seen me for a couple of years, right?
Right.
And how old are you?
I'm 86.
86. So you saw me about what, 5 years ago, and you had pretty severe arthritis in your feet and
Yes, I
ankles.
did.
Okay. And you had a hard time walking, right?
Right.
So we decided to try functional orthotics that we put in your shoes, that we molded to your feet. And tell me, how much better have you been in the past 5 years?
I've been so much better. Really, from the very beginning, I started noticing a difference, and gradually, it has. It's been fine. I've been very happy with it.
So, and you told me that you're wearing them all day long, right?
All day long. I put them on the first thing in the morning, and they come out when I take my shoes off at night.
And really, we're here today because they're getting a little bit on the old side. So we just need to sort of replace them with a new pair, a better
Yes.
pair.
Yes.
You know, medical technology also improves, so they've modified it to where I think they really improved the quality over the past
Yes.
5 years.
Yes.
So for people who suffer with arthritis and are sort of in the shoes like you're in, what would you recommend?
I recommend the
Orthotics.
the orthotics, and be sure and wear them all
Right.
day when I'm on my feet. And it's been amazing the progress I've made.
And I know it's costly.
Yes.
So would you say it was justified to spend,
Yes.
over $400?
Oh yes, I do. I would advise anybody to do it.
So you figure out, there are how many days in a year? 350,
Six.
right? 365 times 5 years. So it's probably what, 20 cents a day? About 20
Or
cents.
less than that.
Right, less than that, right? So I think it's worth it.
It is. Oh yes, I advise anyone
So
to.
well, thank you for sharing the story, because we honestly, we have a lot of patients who are in the same shoes, because that, unfortunately Medicare does not cover it.
Right.
And they're like, well, doc, it's a lot of money. I'm like, yeah, but you have to understand, it's either that or you end up so severely pronated you have to have surgery.
Right. And I want to avoid surgery.
Of course, because remember, and we had that discussion before, it's 6 to 8 weeks in a wheelchair, non-weight bearing,
Yes.
with each foot,
Yes.
and 6 months to really recuperate. So,
And
All
at
right.
my age, I would
Right.
hate to have to go that route.
Well, general anesthesia, hospitalization, the surgery takes over 2 hours to do. So, all right. Well, thank you so much for sharing your story with us.
Well, thank you so much for what you have done for me,
Aw, you're
because
so
it's
sweet.
it's been wonderful
Good,
to
good,
be
Good.
able to walk like I have been able to. I've
good.
just had this trouble just
Right.
starting recently.
And we'll control it. I
Yes.
promise.
Okay.
So,
That's
all right.
good.
Wonderful.